Our second talk for the day will be given by Dr. Maan Awad. Dr. Maan is an internal medicine resident at King Saud Medical City. He is an R1 internal medicine resident. Dr. Maan, thank you so much for agreeing to give this talk. You can start whenever you're ready.
Thank you very much, Dr. Luqman, for your introduction. Assalamu alaikum wa rahmatullah, and good afternoon, everyone. My name is Maan Awad. I am a first-year internal medicine resident at King Saud Medical City. First of all, I would like to thank the organizers for organizing this talk, and I hope that it will be beneficial for everyone who's listening. I will just share my screen. Sorry. Okay, so this talk is going to be about the Saudi Board of Internal Medicine. And the information that is provided in this talk is derived from the Saudi Board of Internal Medicine curriculum, which can be found on the website of the Saudi Commission for Health Specialties. And I will be sharing the link at the end of this talk for those who want to refer back to it. So let us just start with a quick introduction about internal medicine. I'm sure that all of you have a good background about internal medicine, since that we rotate a lot during our clinical years in college at the internal medicine department. So overall, internal medicine is the medical specialty that deals with the diagnosis as well as the treatment of internal diseases that are related to multiple organs. And for the most part, internal medicine patients are relatively critically ill, and therefore the internal medicine physician is usually serving in the hospital. That's why internal medicine physicians are usually given the job title of a hospitalist, since that for the most part, most of their patients are seen in the hospital setting. However, I think that internal medicine at the same time is a specialty that provides also a good combination of inpatient as well as outpatient medicine, which helps create, a wide variety of pathways once you graduate or you finish the internal medicine residency program. You could work in the hospital setting as well as in outpatient setting. I'm just going to pause for a few seconds just to plug my charger. Just a second, sorry. Okay, sorry about that. Okay, so when it comes to the structure of the Saudi Board of Internal Medicine, it's a 4-year residency program that is divided into 2 levels: junior level for the first 2 years, and then the senior level, which consists also of 2 years. And in order to be promoted from a junior resident into a senior resident, you need to pass a part exam, which can be taken during your first year of residency or during your second year of residency. And since that it's an internal medicine program, the most of the time you are rotating in a general internal medicine wards. The total minimum number of rotations or weeks or months that you have to do in general internal medicine is 12 months, and the maximum is 18 months in the 4 years of residency training. In addition to rotating in general internal medicine, you are also going to be rotating in the subspecialties that are related to internal medicine. And if you can see on this slide, you have the list of specialties that are under the umbrella of internal medicine, from gastroenterology, cardiology, and all the other specialties that I'm sure that everyone is familiar with. In addition to that, as part of the internal medicine residency, the Saudi Board of Internal Medicine residency, we have to rotate also in critical care unit as well as the emergency department. And then there are elective rotations, which is up to you where you want to spend them. You could spend them in general internal medicine, in the subspecialties, or even in other specialties that are listed below, from palliative care to genetics, allergy, immunology, and so on. You could also take an elective month of research or community service, such as Hajj duty. So if you look at the Saudi Board of Internal Medicine manual, they are posting this example of the rotations roadmap, which you can just use in order to imagine how the rotations are going to be distributed throughout the 4 years of residency training. Okay. When it comes to matching into internal medicine, so as you all know, internal medicine is a very general specialty, which makes it, and there is always like high demand for internists. Therefore, it's not, one of the competitive specialties with limited seats. Having said that, it is still not, guaranteed, that you get a position in internal medicine. So basically, when it comes to matching, you have the 3 most important things which contribute to the cumulative GPA, your GPA in med school, the SMLE score, and your CV points, as well as the electives. And if you have a decent cumulative score that can get you the nomination into internal medicine in the city that you want to match at, the most important thing that comes after that is going to be the electives and the interviews. And I think that electives are very important because it is true that, for example, in Riyadh, around 300 applicants get the nomination to internal medicine in Riyadh. However, almost only 1/3 of those applicants or nominee are going to get the positions, which means that almost like 70% of those who are nominated are not given or they are not going to match into internal medicine residency program, which makes electives very important. First of all, I think that the benefit of the electives can be summarized in 2 things. First, you get to know the program and the program gets to know you, which is very important because if they know how you work and you rotate with them, they will get to know you, and you can get letters of recommendation from them, which can significantly enhance your chances in getting accepted into their program or other programs. So that's one thing. The other thing is that when it comes to internal medicine, it's a wide specialty. And there are multiple career pathways for you after you finish internal medicine residency. However, there are some variations from one program to the other. For example, in my program, there is limited exposure to outpatient medicine, internal medicine. For the most part, we are just rotating in inpatient unit or in the emergency department because of the high load. However, other programs or other centers might provide better outpatient exposure. So it depends on you and on your preference. I think that doing electives in different centers gives you the opportunity to observe those, centers, as well as decide for yourself. For example, let's say one center is the cardiology fellowship in one center is one of the best in the country. It's good to do your residency program over there because you will get to interact with that subspecialty more than those who are not rotating or not doing their residency in that particular center. So doing electives gives you this opportunity or the chance to analyze each center, and at the end of the day, you will be the one who decides where you want to match, because doing electives in different centers enhances your chances to getting accepted into your desired center in internal medicine. And this is basically, as you can see here, the cumulative GPA that gets you the nomination into internal medicine, which was for the graduates or the applicants of the year of 2021, so last year. And as you can see that it is relatively low. So it is not, I would say that it is not very hard to get nominated into internal medicine in your desired region or city. However, after the nomination, the focus is going to be mostly on electives as well as the interviews and how you do in interviews. So it is true that it is very easy to get nominated into internal medicine residency program in Riyadh. However, after the nomination, as I mentioned earlier, almost like 300 applicants get the nomination, but out of those, only around 1/3 get to match into residency programs. So 70%, almost 70% of the nominees won't be able to, unfortunately, get matched into a residency program. That's why, even though that it is a relatively non-competitive specialty, it is important, in my opinion, to do as many electives as possible in different centers, so that you enhance your chances into getting accepted in the in the center of your preference. And this is basically a link that takes you to the internal medicine, Saudi Board of Internal Medicine manual, which you can read on your own. And it provides all the information with regards to the internal medicine training in Saudi Arabia, from the objectives, the assessment resources, as well as the rotations and the structure of the rotations, and how many weeks you have to do in each subspecialty. So I highly advise those who are interested in internal medicine to get a look at this, at the booklet. And thank you all for listening. Please let me know if you have any questions, and I would be more than happy to answer them. I hope that this was helpful, and I wish you all the best.
Thank you so much, Dr. for the talk. It was indeed very beneficial. We all loved the webinar. If anyone has any questions, then you can post them in the chat now, or you can unmute and ask. We'll be starting the next talk at